What if simply changing the way you walk could reduce knee pain and slow down arthritis? A brand new study out of Stanford and the VA at Palo Alto suggests exactly that. Personalized gait retraining by adjusting that angle of your foot can ease pain and even protect cartilage in people with knee osteoarthritis. I'm Dr. Tammy Penhollow, a joint and spine expert at Precision Regenerative Medicine. In today's video, I'll break down what this study means, who it could help, and how you can take steps, literally, towards healthier knees without surgery or injections. So, what if we can walk our way to reduce knee pain, and if walking differently could do that? This matters. Knee osteoarthritis is affecting millions worldwide and is a great sense of disability in both the United States as well as abroad. And it increases as we increase with regard to prevalence. People suffer from osteoarthritis, and conservative non-surgical options are needed. Most people have osteoarthritis of the medial knee. That's that inside aspect of the knee. It's the most common location when we get unicompartmental arthritis. Remember, there are three compartments. Number one, the inside. Number two, the outside. And number three, between the kneecap and the femur. So those are the three compartments. But unicompartmental is most likely in the medial aspect of the knee. People seek relief because osteoarthritis comes from the wear and tear or an injury or the fact that you've had a medial meniscus repair in the past, etc. And it can cause pain, stiffness. That leads to decreased activity. That leads to muscles around the knee atrophying. That leads to even more joint instability. You might seek out things such as, let me start with a little anti-inflammatory. Let me start with some naproxen or some Motrin or some name your NSAID poison. You also may go in and get corticosteroid injections. We now know that steroids cause cartilage loss. It actually accelerates the rate in which you're going to develop a more advanced osteoarthritis. Then they may say, let me pull on this brace, pull on this sleeve. And there are some special braces, which I've talked about, that unload the medial aspect by kind of gapping that joint and reducing the pressure on the medial knee. You need to wear the brace in order for that to occur. We can also do physical therapy. We can strengthen the muscles on that medial aspect, which are more likely to have gotten weakened and atrophied and smaller than the outside. And that can also stabilize that medial knee. We can use your body's own cells, such as platelet-rich plasma, bone marrow aspirate. We can inject that into the joint itself, into the bones, into the torn meniscus, etc. So we need to fill this gap. We want an effective, non-invasive treatment, which also slows degeneration. So we have that in the orthobiologics, certainly, with platelet-rich plasma being named a disease-modifying drug, which is fantastic, even though it's not a drug, it's your own cells. But let's talk about this study because it also provides a fill in the gap, a non-invasive treatment that can slow degeneration. Let's talk about the study specifically. It was conducted at Stanford, my alma mater, and at the Palo Alto VA, Veterans Administration. There were 68 participants, average mid-60s, a little bit more female than male, all with medial knee osteoarthritis in the grade 1 to grade 3 range. So this was not the severe OA grade 4 bone on bones. These were grade 1 to 3. The intervention. These participants were placed on a treadmill and they had personalized foot progression angle modifications. They would have the patients change their toe in, toe out adjustments, and there would be these vibrotactile feedback on a treadmill. So as they were walking appropriately, and if they were turning their toe in, and that was creating a little gapping on the inside of the knee, that might have given them some feedback that felt better, a little bit of toe out. Obviously, I'm angling a little bit extremely to show the difference. But the intervention was that versus the sham group. The sham group did natural walking without any true modifications on that treadmill. There were 6 training sessions plus a year-long follow-up. Here are the key findings. The pain intervention group had greater reduction in knee pain. Typically on that 10-point scale, they lost 1.2 points. So say you started at a 5, you're coming down to about a 3.8. Not bad for something as non-surgical, non-interventional. Biomechanics. The big deal is they reduced knee adduction movement. They were doing less loading specifically on this medial aspect of the knee. So if you're loading less on the medial aspect, you get less wear and tear on that medial aspect. So the progression of the arthritis is going to be lower. The MRI actually showed slowed degeneration of the cartilage in that medial aspect of the knee. So it's actually proven that the cartilage was preserved. It was spared. It did not go on to increase into that, osteoarthritis grade 1 to 2 or 2 to 3 or 3 to 4 in this group. So why does this matter? Why does this matter for you? It's personalized. It's not a one size fits all. Your gait is modified specifically to you. This is an incredibly effective way to potentially reduce pain, improve function, and to put the brakes on that progression of your osteoarthritis in the medial compartment, which is, again, the most likely compartment in unicompartmental knee osteoarthritis. And then this is going to fit into a broader conservative plan. Certainly, if you can walk more effectively, you can do things like your activities of daily living. You can be more active. You can participate in the weight management. Remember, a 4-to-1 ratio. If you lose 1 pound, it affects 4 pounds of pressure on the knee. So a 10-pound weight loss is 40 pounds off the knee. So imagine if you can do that by just altering the gait, retraining the gait to take less pressure off that medial knee. That can then get you into physical therapy, into strengthening, into regenerative medicine like I do, that whole picture like I do. It then, very importantly, may reduce the need for or delay the need for surgery. What are the limitations of this study? It was small. There were only 68 people. It excluded people with a body mass index of greater than 35. It excluded the people with a osteoarthritis score of 4. Remember that grade 4, a bone on bone. Most people say that they are knee replacement candidates and that they're not typically studied. They're often excluded in studies like this. There was possibly some bias because the assessors were not blinded to this. They knew who had the actual gait training and who did not. So this is still really promising, but it's not the final word. Practical takeaways. You can ask your physician. You can ask your physical therapist about gait retraining programs. You can walk with an awareness of foot position to change that front loading. This is best done with guidance. This is not best done with a DIY, because if you improperly modify your gait, it may shift the stress upward, maybe down into the ankle, maybe up into the hip, maybe up into the spine. So it's really important. And it's also important to consider it along with strength training, muscle strengthening, bracing. I love the medial unloader brace that I've talked about because it does just that. And while you're training the gait at the same time as you're unloading the brace, at the same time as we're building the medial muscles, the vastus medialis of the quads, at the same time as we are using your body's own cells in a comprehensive approach to this whole knee osteoarthritis and knee pain thing, I think that's the ultimate winner. So gait retraining, simple, personalized, effective tool for knee osteoarthritis. Highly recommend you explore this with your care team. Reach out to your doc, reach out to your physical therapist. Please subscribe for more evidence-based joint and spine health strategies. Share this video with somebody struggling with knee osteoarthritis. Thank you. If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.